All right, good evening, Doctor. We will present our student project from SGD B2 entitled Descriptive Longitudinal Study. Next. This is our members. Next. Let me introduce myself. My name is Renaldi Frederick Lagat. Last name is 081. So, first, I will talk about study epidemiology. Study epidemiology is study of the distribution and determinants of disease as well as efforts to control the disease. It's not only about infectious disease, but it's also about social aspect of behavior. Next. All right. Longitudinal descriptive research is so in this opportunity we will talk we already choose one of study epidemiology. It's longitudinal descriptive research. It's a research that compares change in research subject after a certain period of time. This type of research is deliberately used for long-term research. Next. COVID-19 is already give us so many bad impacts to our world, include mental health problem. So we choose one of descriptive longitudinal research to discuss. It's entitled Longitudinal Change in Mental Health and the COVID-19 Pandemic: Evidence from the UK Household Longitudinal Study. It will talk about mental health problems change from before to during the COVID-19 crisis among UK adults, and it also identify groups who are psychologically vulnerable during this pandemic. Next.
Okay, my name Judy Erlangga, last digit name 092. So in this study, there are fears that people have suffered a significant amount of tension and uncertainty from the COVID-19 crisis. So we need to do tracking and recognizing the mental health burden of the COVID-19 epidemic has been described as a focus for public health studies. And the COVID-19 crisis is likely to have a significant burden on population-wide psychological health because social isolation, economic instability, and medical issue contribute to psychological distress. Next.
My name is Kishuni with the last name Kipuwan. So there is a need for longitudinal research that allows for a direct comparison of person-by-person mental health, both before and also throughout the duration of the pandemic, using validated mental health measures. For example, a small study of young adults in Switzerland has been found, where there's an increase in perceived stress and anger measured in lockdown compared to the days where there wasn't lockdown. Therefore, when compared with pre-lockdown, the prevalence of mental health problems was significantly higher in the late April 2020, and this was particularly pronounced among females and younger age groups. Next.
Okay, I will continue the presentation. My name is Niluka Sudana. My last digit name is 171. I will explain about the study design. In this research, this was conducted as a population-based observational study, especially a longitudinal study, which longitudinal study is generally observational because they only collect the data and combine the exposure with the outcome that occur in the sample without providing any intervention or external influence from the researcher. And this study is prospective, which the research is conducted where start when April, May, and June 2020. In this research, they assess the emergence of COVID-19 pandemic as one of the risk factors for mental health problems of the population in UK. Next.
Okay, I will explain about study profile, but let me introduce myself. My name is Idayu Santi Pertiwi Manoaba. My last name is 151. And for this study, there are no study profile listed in the article entitled Longitudinal Changes in Mental Health and the COVID-19 Pandemic, if evidence from the UK Household Longitudinal Study. However, this study explained the study design, which is population-based longitudinal observational study that assess the emergence of the COVID-19 pandemic as one of risk factors suspected of causing effects or problems on mental health of the population in the United Kingdom. Next.
Okay, my name is Nisrai Putra Widyastuti. Last name is 012. I'm going to explain about location and time of the studies. This research was conducted in United Kingdom by looking at basic data from UK Household Longitudinal Study. The timing of this study is not shown, so the author cannot estimate how long the study will last. Next. Data collection method. The data in this study are primary data obtained from the UK HLS baseline dataset, which includes comprehensive longitudinal information on economic circumstances, health and well-being of households from across United Kingdom. The UK HLS data is collected by self-completion online survey or through face-to-face interview in participants' home. Meanwhile, UK HLS COVID-19, the data that are collected in the end of April, May, and June 2020 are collected by online self-completion mode. UKHLS data is a data set which consists of several waves with group every 2 years. Participants who meet the requirement will be entered to the data wave according to the data collection year. Meanwhile, in this study, are using wave 9, there are data collected in 2017 until 2019 because it adjusts to the occurrence of a pandemic that will be studied in this research. And also added UKSLS COVID-19 that are collected in 2020. Next. Next is the study sample. Total population based on UKHLS Wave 9 data responses are 15,012 participants, but there are 619 were excluded because they are missing their general health questionnaire 12. So finally, the final sample of this study is 14,393 participants. Next.
My name is Putu Bagus Pramatana Tirta. My last three digit is 101, and I will explain about the variable operational and research aspects of this study. As part of the socioeconomic status examination, this study examines the demographic characteristics, which includes age, which is grouped into the following 4 groups, and then gender, which is grouped into male and female, and then race, which is grouped into white and non-white, and then marital status, which is married and non-married, and then highest level of education attainment, which is grouped into having a university degree and not having a degree, and then net household monthly income, which is grouped into the following 3 groups. Next.
Okay, I will continue about the variable operational and research aspects. I'm Nicholas with NIM of 201. And continuing from the part of socioeconomic status examination, other aspects that are being researched is part of being the mental health problem examination, which assesses using previously received diagnosis of clinical depression either by physician or other medics, and by using item, General Health Questionnaire, or GHQ. In the GHQ, what is categorized is being psychotic and non-psychotic patients. And another aspect that is assessed is also the risk of COVID-19, which is assessed by using questionnaires and asking the participants if they were NHS shielded patient.
Next, I will explain about determining sample size. My name is Nitya Mangalajaya with name last 3 digit 211. To determine the required sample size, we use a formula as shown in the presentation, where n is a sample size, and C alpha means alpha standard deviation, C beta is beta standard deviation, P is total proportion, where we can count it by P1 plus P2 divided by 2, and P1 is a proportion of the unexposed group who was 6, and P2 is proportion of the exposed group who was 6. P1 can be counted with relative risk times P2, and Q is 1 mean proportion, Q1 is 1 mean P1, and Q2 is 1 mean P2. Next.
Hello, my name is Made Sabrina and the last digit name is 111. So the data analysis for examining the absence or presence of mental health problems is using weighted logistic regression model with cluster standard error, which adjusted for same individuals on repeated observation. And then for the participant from 2017 to 2019, and then to April, May, and June 2020 were checked to see if there are any differences in the number of symptoms by using fixed effect regression with time invariant covariate excluded. And then to estimate the percentage of population in experiencing mental health problems from 2017 to 2019, and during the COVID-19 pandemic, weighted logistic regression analysis with standard error cluster individuals were used. Next.
My name is Pratibha Satyanandara with my name's last 3 digit 240. So the research results shows that mental health difficulties increased by 10.3% for male and by 16.4% for females. Younger adults aged 18 to 34 experience a 18.6 increase in risk of mental health problems. Those aged 50 to 64 years old experience a 9.3 increase, and mental health problems increased by 5.3% more in ages 35 to 49 years old. From this group, there is also a division of mental health problem within those with degree and with higher income threshold. Those with a degree experience a 5.7% greater increase in mental health than those without a degree, and those in the top income threshold experience a 5.6% increase. A certain observation was taken place to find out the recovery in the population prevalence of mental health problems. Analysis showed that there was a 27% decrease between April and June. Longitudinal analysis also revealed that the mental health problem declined from a peak of 37.8% in April to 34.7% in May and 31.9% in young adults experienced the largest decline in mental health problem with 9.8%, followed by females 8%, and those with a university degree 7.4%. Next.
And I will talk about conclusion. So before that, I will introduce myself. My name is Elizabeth Yunuan, with last digit name is 091. And the conclusions are: longitudinal descriptive research is a type of social research that compares changes in research subjects after a certain period of time. The study examines prevalence of mental health changes due to COVID-19 pandemic and identify groups who are psychologically vulnerable during this pandemic. The study was done for the questionnaire on April until June 2020, and the total amount of research sample is 14,393 participants. Next. And these are the references we use. That's the attachments of our the journal we used. And so thank you for paying attention to us.